All right.
Okay.
So thank everyone for coming. We are excited to have you here today to hear from Dr. York on physical therapy. I'm just going to give a quick introduction to Dr. York. So Sheree Chapman York is an assistant professor in the Department of Physical Therapy at UAB. She retired from Children's of Alabama in 2019 with over 20 years as director for the Physical Therapy and Occupational Therapy Department in Early Intervention Services. She received a Bachelor's of Science and Master's of Science degrees in Physical Therapy from UAB and her Doctor of Physical Therapy from Rocky Mountain University of Health Professions. She completed a maternal and child health care fellowship at the University of North Carolina at Chapel Hill, and she is an American Board of Physical Therapy Specialties Pediatric Clinical Specialist. Dr. York has worked in pediatric physical therapy since 1979, including schools, preschools, clinics for a variety of diagnoses, and for the State Department of Education as a specialist in PT and OT services at preschool and early intervention programs. Her most recent clinical work includes newborn follow-up clinic, early intervention, and neonatal intensive care units. In her assistant professor role, she is teaching courses in pediatrics, management, and professional practice. She continues to work in the UAB newborn follow-up clinic, and her research interests include outcomes for premature infants, effective interventions for children and adults with cerebral palsy, and constraint-induced therapy for both children and adults. So without further ado, I introduce Dr. Sheree York.
Thank you, John Paul. I'm glad to be here today. I was looking forward to sharing this information. Physical therapy has been a major part of my life, and I'll give some examples for you. But just for fun, let me let you know that I was at work this morning in my office, and I got a call from my son-in-law that my granddaughter needed to go to the doctor and that my daughter is having a baby today. So this is a very exciting day for me. And luckily, the 1-year-old's asleep, the daughter's at the hospital, and he's on his way. So again, just know that I'm probably a little crazy today. But anyway, thanks for the introduction. I'll give some information sort of related to how that happened. I grew up in Opelika, Alabama, and started my pre-physical therapy college at Auburn University, which was just like 5 miles away. And then I was accepted into the PT program at UAB and after my second year of college, because back in that day, it's been a while, it was a bachelor's program. So, you know, if you were accepted, whether you had a degree in something else or whether you were still in college. So I was at UAB, and I took my first job in a small hospital that was called East End out in Eastlake, and it's now a bigger one. It's part of St. Vincent's now. It was Medical Center East, and then St. Vincent's East has taken over. But so I did that because we were really encouraged to do broad work in our early part of our career before we specialized. I will tell you that these days, if you already know what you really want to do, people go straight into that from graduation from PT school. So I wanted to learn more about pediatrics and academic teaching. And so I got a master's here at UAB and then did the fellowship at University of North Carolina for pediatrics with one of the most prominent, well-known pediatric physical therapists in the world. And she was there, and now she's in Chicago, but I still see her at meetings every once in a while. And then as the education went from a bachelor's to a master's for probably about 10 years after I was in school, and now it's a doctorate. So some of us who've been practicing for a long time felt like we needed to kind of upgrade and catch up with the new graduates. So with all of our history and all of our experience, certainly we've got things that you don't learn all the details about in school. But so I did that in 2010. And it really was a great experience to review some of the basics in physical therapy, but we were also able to take a track that was just for pediatrics. So that kind of built on all my things that I had done in different jobs. So I actually joined the faculty at UAB back in 90 to 96. But in 96, I had an opportunity to work with children of military families, U.S. military families in Germany. So that was probably one of the most fun things I ever did. And then came back, and that's when I worked for Children's Hospital as the director of those departments, as we talked about. And just along the way, you see, I went from hospitals. Public health was mainly home health, which I loved home health. You got to see people where they really lived. And especially the rural folks love to share things like from their garden. So it was just a nice thing to do. But I also worked in early intervention and for the State Department of Education to help build that program, which in the early, well, I guess it was late 80s, the federal government started expanding public schools, and states were given options to, they had to add preschool down to age 3 to the public schools. But they also developed early intervention, and each state chose to do that differently. In Alabama, the lead department ended up being what's now called Children's Rehab Services. And now we have early intervention all over the state. Of course, we've all learned a lot in the last year with the pandemic. I've talked to friends recently. Early intervention right now is still being done virtually, just for safety for very young children, birth to 3. Some school systems, you know, maybe took a short break and then went on back in person, have been there a long time, but a lot of schools in the Birmingham area have just now recently opened or just waiting for fall. So things have really changed a lot, and that affects the physical therapy services we can provide in the schools under all this different, you know, not being in person. So just a little more personal stuff. So my husband actually went to occupational therapy school at UAB and then to healthcare administration, and that's where he worked most of his career. My daughter, who's in the hospital having that baby, is an occupational therapist, and she loves working at the hospital and seeing people of different ages with different diagnoses. I have a cousin who was a hospital administrator, a brother who went into law enforcement, and a niece who did psychology and has been working at Children's Psych Unit. So our family is very much UAB fans and graduates and alumni now. So one of the other things I can tell you about my career and my experience is that I felt so supported from the day I went to PT school from the faculty, who then encouraged me and pushed me to become involved professionally in organizations like the American Physical Therapy Association. And one of the other fun things I did this morning is I'm currently president of the International Pediatric Group, and we had a networking session with about 80 people from around the world talking this morning about what we do and what we focus on. So I say that not to, you know, sometimes I feel like I'm bragging when I'm telling you what I've done, because I'm so proud of everything. But I'm mainly just thankful for the people who just took me along and really supported my career. So again, I do a lot of other fun things personally, and these grandkids are my heart right now. So this would be the grandkids, and on the bottom left, that's Greg still running around trying to get down there. Sarah's there, and this was Everett when Arden was born 20 months ago. So, but the other thing I'm showing you is that I'm going to talk about physical therapy curriculum in general, but the first pictures I could pull up were the things that I do. So this is an example on the top right of what we call baby lab, but it's not literally tiny babies. It's usually at least 6 months old up until maybe 10. The students learn to recognize typical development and problems in this lab. And even the guys, particularly the guys and some girls who don't really think they want to work with kids have a ball with working with these kids. So this was 2 years ago. Last year, we had to do these evaluations virtually. So that was interesting. And I had neighbors and friends, kids being evaluated. So I was able to just run out in the yard and see what was going on with what the students were doing. This top left one is actually a more continuing ed course that we provided for other physical therapists. And again, we brought in children and just talked through what with the families and the child, if they were old enough to explain what they had gone through with their diagnosis or their treatment plans. And then we practiced interventions, especially with some of the participants in the course were pretty young therapists who were wanting to become pediatric therapists. So that's enough about me, okay? So we're going to go forward with, so what have you done today? Other than eat breakfast, put on your clothes, brush your teeth, maybe get on a bus or go to school or go to work for those of us who work. And how would that change if you had broken your femur, if any of you've had anatomy, that's your bone in your thigh, burned your hand as you were cooking breakfast, tore your ACL, which is part of your knee ligaments, and then, or you had a spinal cord injury, you were in a car wreck or you fell down a staircase and you broke your back or your neck. That would change what you were able to do and how you were able to do it. And that's where physical therapy comes in. So we're pretty much known as movement specialists. And that means that we've learned as much about the body as we can, and that we're there to help those who have some sort of physical disability, injury, or condition that might have even been there at birth. So these are just some pictures of showing different ages. And I'm sure you've seen grandmas or great-grandmothers sometimes with walkers or people in wheelchairs. Now, these are pictures of actual PT students. This group is actually in their third year and they're in clinics now. So they were working on some vestibular work at the bottom left, working with that child in the baby lab for the evaluation on the bottom right. At the top, that's in a lab where they were learning. She's got a little goniometer kind of like device to show the range in the neck and the upper back. And then this other one is helping someone walk with partial body weight support using a walker. Here's some other examples. The first one at the top left is, that's at Children's Hospital outpatient department, and it's called a cage, but they're using bungees to support the child so that they can learn to jump and move with support rather than having the therapist hands on them all the time or not being able to do things. This happens to be one of my cousin's kids, and he's now, gosh, I think 21 or 2, and still does some really cool things. The middle one at the top is this is more like orthopedic therapy, working on manipulation of the knee or an assessment of the knee. You see the older person walking with the walker, and that is in parallel bars. And that's the first way we try to train people to walk, is with those bars that are very sturdy and stable before they go into walkers or canes. The one at the bottom is more like an ultrasound or a deep heat to help with healing of pain or muscle tissue injuries. And then, of course, this one at the bottom right is home health, and the therapist is in the lady's home and helping her work with her shoulder. So I don't know if she's had a shoulder injury or a surgery. Here are some other examples. You see a pretty healthy looking guy. That would be more like sports PT. Again, orthopedics in the middle. A child with an amputation and a prosthesis. Down at the bottom, this is someone who needs a lot of support to get her up and moving. And then we do a lot of aquatics as well. Sometimes warmer water to help with dealing with pain, or, just in a pool, you can move your body more easily because it's sort of like the water supports you. So we do a lot of work in pools. Again, parallel bars, working with large balls, another guy with a prosthesis, and just this one at the bottom is another large therapy gym. This would be very typical of what you would see over at Spain Rehab on the UAB campus. Again, we work with research. And so these are some of the subjects who've come in to be tested. You see a UAB football player. Gait analysis, where you see that green and red graph, and then the real person's leg. So that's analyzing what kind of movement they have and what we might could do with therapy to improve that. Again, this one at the bottom looks like she's sort of dance running on a treadmill, and they're using electromagnetic pads to come up with the data. Now, I'll just share with you that at the bottom right, this constraint-induced movement therapy was actually developed at UAB, first with monkeys, and with Dr. Ed Taub, is the older guy with the little white part of his hair. He's in his 90s now, he's still going strong. But constraint-induced therapy means you somehow restrain the good arm and force them to use their affected side, and they learn how to do more that way. So that's a pretty cool thing that's going on. In fact, most recently, the UAB announced that Dr. Taub was going to use a constraint-induced model for cognitive improvement after COVID. So a lot of stuff going on pretty famous at UAB. So if you're interested at all as a physical therapist, you want to know what kind of patients. Well, you saw a whole lot of pictures of different ages, but truly from birth, tiny babies, even tiny premature babies, up until just before death. So all through the lifespan, different ages, different things happen to different people. Again, some are often just looking at sports and performance, high level. Others have an actual disability or a disease that has affected their movement. That's where PT comes in. So as we look across the lifespan, again, this top left is a tiny baby in a neonatal intensive care unit. This little girl with crutches, pretty pink crutches, and looks like even her braces have a little pink on them, as well as do her shoes. So again, then sports, looking at gaming. This is part of a research area over at Lakeshore Foundation on Lakeshore Drive. And then bottom right is more like a typical hospital scene of helping someone walk down the hall with a walker. Now this is more looking into, as you look at the top ones, the top left is looking at what's called work hardening. So you've had work injuries, and the patients will come in with very strenuous, very frequent exercises to try to improve. And it's based on not just general body strength and coordination and all that, but what did they do at work? So this guy's using his hands to turn the faucets, turn the screws, and deal, with tools. The one in the middle is more like a geriatric gym, it looks like to me, like exercises. It could be public or it could be part of a therapy practice. Definitely supporting runners. One of the things coming up soon in Birmingham is the World Games for those with disabilities. And so we're very involved with making sure they stay safe, as well as the those are the participants, the competitors, but the audience, the people who come to see them. And physical therapists are going to be there to make sure they're safe getting in and out of bleacher type seats or finding the stairs or the elevators. The bottom again is another lady helping at home, and then another prosthesis and just general strengthening. So the top picture here, where would you work? So I've sort of mentioned all the different places you could work. That is actually UAB's Spain Rehab. You could work in a school system. A lot of lady physical therapists who like to work with kids, like to work in the school system because their work is the same as what their kids would be doing as far as schedules go. So they would get off at 3 or 4 o'clock. They would have the same holidays as their school kids, and they might not have to work in the summer. So this is a classroom where you see kids who have some sort of disability, some of them do, wheelchair and a walker, and their friends all playing and learning together. And again, another big gym with lots of equipment. So what would a typical day for a therapist be? Most of the time, at least by the time you go in, you're happy, like on the right. And by the time you end, if you feel like you've made a difference in other people and that everything's fallen into place, you're happy but tired, ready to go home for dinner. Now, there are a few crazy days. It's like if you're in an outpatient clinic or the hospital has way more patients than you had planned to see that day, and they've got to be seen, especially if they're ready to go home or they're brand new and they need to be evaluated. So some days you just kind of have to rework what you had planned and go with the flow. Other things you probably want to know is like, well, so how much money, what would I make as a physical therapist? In 2020, the average kind of median range was $86,700. I will tell you that those who own their own practice and do the really creative extra things, they may also have contracts for like a nursing home or a home health agency. They are going to make the most of anybody. Those who work in, so median means all ages too. So you won't necessarily make $86,000 when you first go in, but I'll tell you, by the time these students were going into their career, it really could be in this range. So it all depends on how long you've worked, what you bring. Like even as a student, where did you do your clinics and were they relevant? Do they match the job you've been offered? It also matters what state you're in. Certainly Alabama's not the richest state as far as things go, but it's also not the most expensive when you go for buying a house or eating out or buying a car. In general, there are great hours and benefits, no matter which setting you're in, and you can just choose. I know of one couple now at UAB who are both physical therapists. I think they met in school, and they job share. So they don't have to put their kids in daycare or babysitters or anything. They just alternate the days. So there are lots of opportunities like that to be creative. At this point in the US News and World Report for best jobs, we're still in the above top 20, so around number 12 at this point for things people appreciate as far as being paid well enough for what the work you do and for what you spend in college to get to college and through the programs, but appreciation and satisfaction with your job. The career outlook for years, at least into the 30s and 40s, is definitely good. There are going to be jobs available. There's a shortage of PTs now, and there's a need for PTs from diverse backgrounds as well as those with diverse skills. So again, if once you're in PT school, you're going to all learn the same sorts of things, but you may have an interest in one or two areas and ask to do your clinics in those. So you may come out feeling like, I knew going in I was going to be an orthopedic therapist, and that's where I'm focusing, but you're going to learn the basics together and be able to work anywhere. There's going to be more and more participation and roles for physical therapists to play with sports and fitness. And that may mean healthy people who just want to get stronger, run faster if they're a runner, swim faster if they swim. We're looking at the graying of America. People are living longer, and that's what gray is, for the gray hair. We start having around the 50s and 60s usually, but that people are actually living longer, and that means they may be totally healthy. I know a 96-year-old woman who still works with me in clinic and was playing tennis until she fell and hurt her knee and her kids made her quit. But there are plenty of very healthy older people, and yet they still need to be watched, but injuries can happen at any age. There's continual development of new diagnostic and treatment techniques and lots of equipment. You'll see lots of cool equipment with physical therapy. And we're finding new things through research all the time. So now let's talk about you and where you are now in high school and how close you are to graduating and what you're thinking about next. So certainly we have options for junior college and then transferring to full out university or starting straight into a university. But you want to be thinking about what your college major would be if you were to want to pursue physical therapy as a career. You'll have lots of options if you keep your grades up and study hard. And this is just an example of the kinds of courses you would take in college to go and be accepted into physical therapy school. So these are the cuter pictures and here are the words. So the required courses as you try to submit for admission to physical therapy at UAB, and this is pretty standard throughout the United States, you would have at least 6 hours of English comp, 6 hours of psychology, 12 hours of biology, and 4 hours of physiology combined for 16. So there's your basic science. And then you'd have to have a lab with those. Pre-calculus or trig, and then 8 hours of chemistry for science majors, and there's a lab with that. 8 hours of physics for science majors. And then medical terminology is more about understanding the words we use. So that's anywhere between 1 and 3 hours. Keep me posted. And then 3 hours of stats, and that can be a math-based or a psychology-based statistics course. So just off the slides for a minute, the main thing, of course, is to just do really well in college. And I've seen lots of people, even the super smart ones in high school, who go into college trying to do the really hardest courses first. Fortunately, more universities are going to like a basic freshman curriculum for everybody, which may help, but you have to watch out for that partying or too much work if you're trying to work and go to school at the same time. So just some hints of know what you need to do within the 4 years of regular undergrad college, and make sure you have the time and the focus as you go through these courses. These are the ones you need to have A's and B's in to get into school. So you don't really have to have all A's or A pluses in college to be accepted, but you need to have those A's and B's in those kinds of courses that are required, and particularly kind of wash off some of the others if you really blew freshman year. But again, really focus as you go. One of the other things that's required for pursuing physical therapy is shadowing or observing. And what we found is that a lot of our students that end up in the program have actually had paying jobs as an aide in a therapy practice or hospital. But at this point, we're having to kind of be a little more flexible about the number of hours that are required due to still COVID kinds of things where some places don't let you just go in all the time. But this is an example of a young student observing what this physical therapist is doing.
Dr. York, can I interject for just one moment in case we lose people off the call? We're actually partnering with some physical therapists, and we have shadowing and tele-shadowing opportunities for physical therapists available. I'm going to talk more about that, but in case we lost people off the call, I'm going to put my contact information in the chat. So if you're interested, these are both in person as well as tele-shadowing as well. So just wanted to get that in there in case we lost some of our participants.
Good. So now let's say you've been accepted, or you want to understand what you're getting into before you even apply, right? So at UAB, and this is true of a lot of university PT programs at this point, there are some online ones that go a little faster, but you know, we're a little skeptical about how much hands-on actual experience they get. So of course, I'm going to promote UAB, right? 9 semesters overall. The first year includes anatomy. You do have to know everything about the human body. Then analyzing movement, neuroscience, how to examine and provide services or therapies, interventions for people with physical therapy. We again go through human physiology from a PT perspective, pathology, pharmacology, professional practice, scientific inquiry. The scientific inquiry is more about beginning to look into research. What's been published, what's the latest, what are we supposed to try, and what questions do we still have to improve our work. The second year, we go in more to looking at the disabilities that people have that we would be treating. So looking at human movement, musculoskeletal, cardiopulmonary, and neuromuscular systems, again, more on research. And we begin learning about how to manage our practice, especially if you want to be an owner or a director sometime. And then the students this summer, second years, will have their first clinical education experience. And then the third year, they come for about a month. We work on one of the classes that I teach is on PT management, where they are creating a very novel kind of practice that they would build, as well as touch a little bit more on the final general professionalism topics. And then they go to clinic the rest of the year until graduation in the fall. They do a capstone experience. Some of them do that more as true research, and they'll work with researchers to do that, or they can just have a specific project that's been approved. Graduating in the fall. What happens after that is that you have to take an examination, a national examination for licensure. And some choose to take it in that fall, just as they're finishing clinics. They've been studying all along and they feel like they're fresh with that. But most take it when it's in January or February. And luckily, at least 99% at UAB pass it the first time. Some choose to take more time to study and take it a little later, or missed a few points and have to take it a second time. But the other thing I'll tell you is from these clinics, often you'll be offered jobs right away if you've done well in clinic, or they may be able to tell you about another friend who has another practice or an opening. So you're always looking for, I think I want to work in this kind of setting. You want to know those people, and that starts from your observations even before you go to college. So again, here's the National Physical Therapy exam. We do have the students go through an old version of one to practice what's it like to take this high level of examination. And then we do some reviews and things as they go through school. So just wanted to really show you some of what it looks like to be in the program. So the students obviously practice themselves with how to use the equipment. Everything from walkers and canes to, this is a tilt table for someone who needed help getting into standing. But at least for pictures, you see that everybody looks really happy most of the time. And they do have a lot of fun. Look at them playing in the motorized wheelchairs. They go out to Lakeshore Foundation and challenge the really very successful Lakeshore wheelchair basketball team. And they always beat the students big time. So it's pretty hard to throw a ball up in the air from a wheelchair. They're learning how to tape. So in the bottom where you see the pink and blue, trying to stabilize their kneecap or whatever they're working on. And the top right is one of the best PTs in the world, because I've seen her as treating at UAB, but also she's on faculty. This is where the students are learning how to do the interventions, the manual therapy and the stretching and that sort of thing. That's what our lab looks like with all the plinths and sheets. Then you look at working together on a mat table, but the students, they just do a lot of great things together, and they really explore a lot. They do some volunteering as well. We do have them going into other facilities just to learn what's going on. And so here's some examples again of them learning and then competing with each other. So lots of fun. This NSC is actually the National Student Conclave, which is a professional meeting for students to attend while they're still in school and learn more about physical therapy. We've held it in Birmingham before and often somewhere in the South, but it kind of moves around every year. So again, working on balance. This one at the bottom is really looking at vestibular things and looking at what goes on with the eyes and the ear, what the internal part of the ears as far as balance and vestibular goes. And then this is just showing you very happy people. They are these days put into lab A and B because we can't have the whole class in a lab without distancing, but we are coming back together in the summer. But they get to know the teams they're on. This is the top right again is another professional meeting that occurs every year, and the students are usually supported financially to get there, and some of the faculty are in that picture as well. In the exhibit halls at different kinds of conferences like this, you get lots of freebies, so you always want to go do that. Again, just fun. You see this group at graduation. This face right here in the middle here, she's actually the director of the DPT program at the school. And then this lady right here, the baby, and this is number 2, but she's home with number 3 now. And she is our admissions person. And she's also a physical therapist and teaches as well. But I've been working a lot with her on her committee while she's on maternity leave. So that's a lot of fun. So I did want to mention that there are such things as physical therapist assistants. And this is a very appealing job as well, in that you don't have to go to school forever. You really have you have to go 1 year maybe to a junior college or a regular college, and then 1 more year of school. I know of people who have BS degrees and some other, they've gone 4 years, but then they decide they want to go into physical therapy, but they don't want to go to school for 3 more years at about $100,000 over the 3 years. So a lot of people choose this. The physical therapist assistants are licensed. They work under the direction and supervision of physical therapists. And the only thing they can't do is do the initial evaluation, plan for the discharge, like when the patient's going home, or perform the most complex interventions. But most of them learn pretty much anything else we do. And they work very closely together. They're like a team. And I've worked very closely with PTAs in multiple settings, school system, hospital. And a lot of them, when I asked them, what did you think about becoming a PT? And they were like, I don't want to stay in school that long, or I wanted to get on out there and work. So, and then others will say, particularly those women who have either want to work in a school system or want to work with kids, particularly find that they can make their schedule more flexible. So it just depends on the setting, whether that's true or not, because hospitals probably aren't that way as much. But in Alabama, you after that 2nd year, you get an Associate of Applied Science degree from an accredited school. You need to pass a state and a national certification exam, and then you obtain your license just like the PTs do through the same board, and it happens to be housed in Montgomery. So that's how you become a physical therapist assistant. And there are now, six programs in Alabama. And people are very happy with that opportunity and that job. So we'll leave you mainly with that. I've given you some websites, and I do want to activate one of these videos just for you to see that if you go to this website for apta.org, that is American Physical Therapy Association, both for PTs and PTAs. And there's one video that I just think will tell the story even better than I did. And you can go back and look at these others. But Also, just note that the UAB website for PT is right there as well. Let's make sure this is going to work. Oh, it says it's not available.
Dr. York, can you copy the link for the video and put it in the chat? And then maybe
Sure.
students can
Yeah,
grab it from the chat and watch
let's
it
see
later.
if I can.
Thank you.
I'm trying, okay? Let me go back to that slide. This, the reason I wanted to show this, and I watched it several times and it worked fine. Just need that first one. But it's the You Can Be Me. Well, okay, let me just write it down real quick, and it's a YouTube. Need to find a pen. Or do one of y'all have a pen real quick and you can put it in the chat? Or I'll go find one.
I'll type it up in the chat right now.
Okay, great. So that's just the end of what I had prepared to share with you, but definitely would welcome any questions if any of the students want to ask more questions.
Actually, while people are thinking, I have a question. So for the students that are interested in applying to either the PT doctorate program or the assistant, what kind of activities would be good for them to enhance their applications? So, you know, they maybe could get a job at a PT office, or what kind of community service do you look for? What do you look for in enhancement of applications?
And I'll say just in general, it's very similar for both the assistant and the physical therapist programs. Looking for, do you even know what physical therapy is? So the way we know that is whether you can explain it, or you went with your grandmother or your parent when, or you were injured and you went for therapy. But more than that, again, we like to see observations in more than one setting. So maybe you call a hospital. Here, there's lots of hospitals in this area. So, you know, you just call up and ask for the physical therapy department and say, you know, I'm interested in shadowing or observing. Minimum probably 4 hours. If you can get a whole day in, that's great. But you want to do at least 3 different places. So maybe a small hospital, a large hospital, a sports clinic, and an orthopedic outpatient clinic. You might ask someone, hey, I think I might like kids, and we'll be able to tell you that, you know, during school year, and some schools have summer school as well, that you might be able to observe there, or with early intervention going into homes, or with home health for people with any age. So again, it's any setting, and just knowing that you sort of understand it. Even better if you can get an aid position, a paid position, that where you're able to help placing the patient safely, possibly putting heat or cold or ice or whatever on them to get ready, you know, to help the pain and then be ready for their exercise. There's some simple kinds of things like walking down a hall that you'll be able to do yourself, and you'll be trained to do it safely. You just wouldn't do the real complicated things you learn more in school and with higher levels of practice, you know, when you're actually licensed. But yeah, observing and or getting a paid job. And I will tell you, even because PT school is really expensive, it's, you know, people really want to go ahead and even work while they're in school. So I know of people who are working in gyms. Some are doing DoorDash. These days, there's so much, you know, need for home food, people to bring it in. But you just have to work around your class schedule because you are really fully scheduled. But that's the main thing about that. And then I saw a chat question as well. The most common injury, I think it would, I'd say, I don't know that there's any one. Back pain, particularly in older people, or people who do real manual labor kind of work, is probably very common. And then the next things I think would be hips, knees, and shoulders, injuries, just even injuries. But as people get older, often they have problems and they have to have what's called a total knee, and it's where they put in a hip joint. I mean, no, a knee joint or a hip joint, or now even shoulders, where it's sometimes it's like a plastic looking cup with then a metal ball. This would be a hip, and then it would go down into the bone. So those are the most common, as far as those with a lot of therapy or a surgery even. But there are plenty other simpler injuries, even just, that's why I want y'all to watch that video if you ever have time. There's an example of a young girl, she looks to be about 10, who's a dancer, and I'm talking about really, really good dancer, like, you know, doing all kinds of crazy stuff that most of us can't do. But she was having trouble with her feet, with pain, and the therapist was trying to help her with using tape or a simple, like a little insert you put in a shoe to get her feet to land right when she did those flips and those ballet type jumps. And that would be similar for any kind of athlete, whether you're a runner or actually, you know, high school or college football, baseball, all those things. So those are very common. How many patients do you see per day? For pediatrics, you would see one patient per hour usually. And you might try, either you have somebody who doesn't show up for their appointment, or you try to schedule only 6, because you actually have to do documentation in a medical record as well. But the difference in occupational and physical therapy, this is how I've explained it the most when I used to do tours for guests at Children's, and because I live with 2 OTs. Physical therapy is more focused on the bigger motions of the body, you know, like running or like raising your arm and using your body in any way of work, dealing with pain, you know, getting over it, having treatment for whatever the problems are. But the occupational therapist, and people get kind of messed up thinking occupation means job. It doesn't. They use that word occupation as your occupation for life is you eat, you bathe yourself, you get up and down, you do some play, you sports, whatever. You drive a car. So it's the things you do with your life as far as activities go. And so they work a lot with hand coordination, the use of especially their hands and arms. And for children, there are children with autism spectrum disorder that OTs often work with to help them get over the being sensitive to sound or sensitive to touch. So those are just some examples. PT,
Dr. York,
yes?
because we're getting so many questions in the chat, I can kind of ask the questions from the chat
Okay.
just to kind of help you. So one of the ones we had were, what are some of the challenges of being a physical therapist?
I guess in a positive way, some challenges are trying to figure out what's going on if it isn't a real traditional kind of injury or illness. And so you're working with doctors, you're working with other disciplines like maybe speech therapy, occupational therapy, social workers, nurses, if you're in a hospital, and you're trying to come up with, now, what's really going on with this patient and what's going to work the best. So that's always a challenge. Now, the more experienced you get for the more common injuries or illnesses, you may specialize and go into working more in that way. But that's where the challenges are. Or the frustration is when you've worked so hard with a patient or given them a home program and they never follow through, or they do the very opposite things that undoes, what they might have benefited from the therapy.
All right. Are different patients appointed to different types of physical therapists? For example, those wanting to get stronger or those with injuries?
It depends on where you choose to have your physical therapy. So obviously from the hospital. Now, if you've ever been to any of these hospitals, especially like UAB, Brookwood, St. Vincent's, the big ones, they've got all kinds of different units. So everything from the neonates to the tiny babies, children's ward, burn unit, intensive care units, and they may be specialty intensive cares. One may be pulmonary, one may be surgical, one may be whatever. Most of the time, the therapists sort of get assigned and learn and sometimes get to choose which type unit and which type patient they would work with. In a smaller hospital, like let's say Troy, Alabama, because I worked there for a little while, or next door to there with the kids' clinics, but they might just have two therapists who have to see whoever's in the hospital. So that might not be so specialized, but the ones who specialize the most are those who have their own outpatient clinic. There's one that I know that a dancer who used to work in sports medicine at Children's opened her own practice to focus on female athletes. So dancers, runners, all that. So if you are a female needing that service, that's who you should go to. But you may end up being referred from your doctor to just the closest private practice that's maybe more orthopedic. They're going to be great with any injury and any age. Those people have specialized typically in those areas. So if you want to work with old people, like in a nursing home or just treating people who are older, there's also training and continuing ed courses for that. So people can specialize and get specialty certifications after they're graduated from school.
All right.
There's lots of chat questions, so pick one.
Yeah, lots of questions. How many therapy sessions does a patient need, and does it depend on the type of situation they're in?
It totally depends on the type of situation. An example that I observed in a continuing ed little thing yesterday was this person over 6 weeks went twice a week and worked on both of it was 2 cases and they both had knee injuries. And it was about 50 minutes to an hour per session, twice a week for 6 weeks. And I saw the results of their data, what they evaluated initially and how they were functioning later. So it could be as short as 6 weeks. For children who have disabilities for a long time, because that's my area, what we really like to do is do more intensive therapy, like say 2 or 3 hours a day for 5 days a week for 3 weeks, and then check in with us 6 months from now if you have any other issues. And that's really teaching them to move and dealing with the complications they have with things like cerebral palsy. But those orthopedic injuries in general are the ones that are done within 6 weeks. Sometimes people re-injure the same body part, or they do something else kind of crazy, or fall, or break a bone, or have a surgery, and the same people may come back in. And that's the beauty of being in a town where you go back to the same hospital or back to the same practice, and you actually get to know the therapist, they know you, and that's sort of how you can go with what who does the best at this. And there are lots of private practices around here. Some are from big corporate groups that are all over the country, and others were really started right here in Birmingham, and they're still doing that. And people start up practices all the time. Have I ever encountered someone who doesn't want to be helped? Some people, they want to be helped, but they don't want to do what needs to be done sometimes. So some people, if they're in pain, they just want to sit and watch TV and don't mess with me, And if you're a home health therapist, it's really hard to get them out of that chair. But a lot of people really do want to feel better, but maybe don't want to do their home program, or they want to still go back and not do what's been recommended. So yes, that's hard. You have to find a way to make it more fun. So we do a lot of game type things, even with adults. and trying to make it like, what do you really want to do? Let's practice that. Let's don't do 10 stretches. Let's bend over and pick something up off the floor. See if you could do that safely. There's one question about how many hours a week do we work? It just depends, truly. If you're full-time hospital, you're going to work 8 hours and probably some weekends. And the staff won't all work every weekend unless you intentionally want to work weekends. I know people who work at Children's who work at UAB on the weekends, but not every weekend. It's like once a month. Some people do have jobs that are part-time, and it just is all about the management and what your skills are and what they can handle as far as how many people they need there. I haven't
You have
personally
a question?
ACL. I don't personally know about that because I've never really worked in that area, but you're in the town where Dr. Andrews and all the famous orthopedists are, or originated here in Columbus, Georgia, I tell you. I mean, there are others in the country, but these are the ones in the South that are well known. And there are lots of orthopedic surgeons who then hire PTs and they train them to help with the post-operative surgical sorts of things, and just get to be experts and well known. So somebody really knows about that, so that's good.
If
We
I
had
could
an-
also,
Oh, go ahead.
oh, sorry, go ahead.
I was just going to answer one more if we have time. Who determines patient goals? That's an excellent question, because really we start off with an evaluation, and it isn't just I'm going to measure your leg and watch you walk. It is first talking about is this an injury? How did you injure? Is this a surgery? How are you doing? So we're talking to the patient, and if they're very old or very young, we're talking to the family that's with them, the family member that's with them. And we have goals of what we know they ought to be able to do after our therapy, especially if it's orthopedics. But what we really want to know is what is it that you could do before this injury or whatever that you need to be able to do again. And it's often, I want to be able to pick up my grandchild. I want to be able to carry the groceries from the car. If you've had a shoulder injury, things like that. So it really is getting to know your patients. And to me, that's the beauty of physical therapy, in addition to getting to work with bodies and help them get better in movement and skills, but that you get to know them and you're really trying to help them where they live and what matters most. Okay, so I'll quit reading chat questions now.
I was just going to mention that we're joined by some of our past what we call SHPEP students. So when you guys get to college, look out for the shpep.org website. We have a program here at UAB, and physical therapy is one of the concentrations that we have in that. It's a 6-week program in the summer. You get a stipend to do it. You can do it your freshman or sophomore year. And there's information. I'll put the website in the chat. And if you're interested, just keep an eye out for that. It's a really good way to make connections with the PT faculty and find out more about the career. So just keep that in mind when you get to school. And like I said, we're actually being joined by some of our past SHPEPers, so hi to those. But just watch out for that when you get to college. So.
And I would add that if you end up going to undergrad at UAB, which is a great school too, there is a pre-physical therapy society, and they meet about once a month, except I don't think they meet in the summers much because a lot of people don't go to school in the summer, but they meet about once a month, and they bring in therapists. They help you find somewhere to volunteer, observe, or even get a job. And then the faculty comes in some to answer questions, like what we've talked about today. And several of them end up, they're admitted early because they are just that, into it and wanting to make sure they do everything to get into school and to have a career as a PTA or as a PT.
One
Actually,
other
lines, sorry, if I can just mention while I think of it, along those lines as well, and you may have said this in your talk, that there's an accelerated bachelor's to PT program to DPT. I know a family friend is doing that right now. I guess you've got some pretty good grades to do that, but you can go straight from high school to an accelerated program. Sorry, Carolyn, go ahead.
Yeah.
Oh, it's okay. I also put in the chat a link to a Google Doc. If you all will go into that Google Doc and fill in your information, that would be very helpful for us.
And there is early acceptance as well. And that's when you're still a senior in high school and you can qualify for that if your grades are high. And you know, we can say your early acceptance, and that doesn't mean you go to school early. It just means you go and do your undergrad first. And as long as your grades are still good, you are definitely officially admitted before we look at all the other people who applied. And I can tell you too that there is a real need for diversity in all kinds of ways. And that's either from your background, your race, your opinions, you know, your male, female, whatever these days. And also just knowing your interest. Like, have you lived in other places? Were your parents military and you traveled? Just, we like to learn about people who've had different experiences so that the class itself is not all looking the same and all wanting to do only ortho or only private practice. We're really looking for people from different backgrounds and really balancing that out because our patients all come from different backgrounds. And some really do want to connect more with someone who looks or acts more like them. So that is a real goal. I think you can see that throughout UAB in general, and even better than most of the other universities in the state that I'm aware of. So again, you know, I have had such wonderful opportunities just by being open to people offering to teach me to, we did a conference one time at VA in Tuskegee, and they were all trying to get me to work there. And I was like, I actually have had a great time with y'all today, but you know, I'm still trying to work with kids. So, but there's all kinds of settings, and there's military physical therapists and military, hospital, outpatient, home health, children, you name it. I even got a magazine this week, and it's wilderness physical therapy. Now, even Alabama has some wilderness, you know, those places that aren't very populated, aren't cities. And so that was very interesting because people have a lot of injuries who do all that, live out in the woods or hike a lot or camp a lot. And, you know, it was a very interesting article. It's probably not something I would do, especially not at this point in my life. But, you know, you wouldn't believe the first physical therapist I ever met had actually been a trainer for, it was a professional football team up north, one of the Chicago ones. And he ended up moving to Opelika, and his wife was his assistant. I mean, I think she was a PT assistant. And just listening to these folks, when I was in high school, I was on the academic track, which I hope most of you are or hoping to be, so that you're ready to have a career like this and to pursue something in healthcare or highly technical kinds of things. But one of our personal friends was the vocational teacher, and she knew I was interested in healthcare, so she let me go on all the trips. So I went over to Columbus, Georgia, and saw the Andrews Clinic that was there and the famous physical therapist that worked with them. And then we had, you know, like healthcare days at the hospital, and I even got to go visit children's rehab now, but it's the clinics that work with kids birth to 21. So just if you hear somebody, you know, in your neighborhood, church, a friend, or connections through school, just ask about, could I come learn that? Could I spend a half day with you or a couple hours? And that's what inspired me more to really focus on physical therapy. And I will tell you, this will be my closing statement than anybody else who wants to talk, but, you know, Now, John Paul, nothing against medicine, but what I think I hear a lot from people who super smart kids who thought they wanted to be physicians realized once they shadowed that usually your physician spends about 10 minutes with you. I hope you don't. I hope you spend more time. But, you know, like the nurse does all the stuff, the prep, and the doctor comes in and says, tell me what's going on. Okay, here, take this medicine. So the relationships are really deeper for those who spend more like an hour with your patient. So that's going to be my last thing. And again, I've had some wonderful physicians who did take a little more than 10 minutes. And I know plenty that I work with that I know do, but just know that one of the best things about physical therapy is the relationships, both with patients and their families, as well as with the other disciplines. You work with a physician, you work with a physician assistant, with a nurse, with, again, occupational therapy, speech therapy, and you become a team, particularly if you're in a hospital or a specialty type clinic. Okay, I'll try to hush.
Thank you so much, Dr. York. That was very informative. You covered all of the questions I had. There are some things that I didn't even know. The wilderness PT, I had never heard of that. And so very informative. We really appreciate it. And so I thank everyone else for coming today. Please fill out the Google form. We just use it to track attendance. And additionally, we have our last career spotlight on April 23rd, and we'll be going over nursing. And so thank you all for coming.
It's good seeing you.
Thanks everyone for joining.
Thank you.